Well, hello and welcome to Raj Sabha TV. You're watching discussion today with your host Rajat Kane. In this episode, we'll discuss the findings and significance of India's first survey on its older population. The Longitudinal Aging Study of India, or in short, LASI, is India's first and world's largest survey till date, which provides database on India's older or to say elderly population. It also stands to guide to policymakers to formulate policies and programs for elderly population on the parameters of social, health and economic indicators catering to the well-being of our elderly. The study will also be used to strengthen and broad base the national program for older persons as it include representative samples of socio-economic landscape of India and our states. Well, India also has world's most ambitious Ayushman Bharat scheme, which emphasizes the expansion of healthcare facilities to the elderly population. Now, to discuss further on this issue and how this survey holds significance for ahead, we are joined with a panel of two important guests. Well, we are joined with Ms. Urvashi Prasad. She's public policy from Public Policy Specialist, I beg your pardon, from Niti Aayog, and Dr. T.V. Sekher. He is the lead investigator of this survey, and he is from Indian Institute of Population Science as well. Many thanks for joining us. Dr. Sekher, let me start with you here first. Now, just for the benefit of our viewers, could you elucidate as to how significant this survey is and what were the broad findings to begin the show with?
Okay. Thank you for having me.
Many thanks, sir.
The longitudinal aging study in India, or popularly called as LASI, is the first longitudinal study of India, and in terms of its coverage, sample size and scope, it is the largest longitudinal aging study in the world. And in 2016, Ministry of Health and Family Welfare, Government of India launched this LASI study in order to generate a scientific evidence and database for India's growing elderly population. As you know, 2011 census, we had nearly 100 million elderly population. But in the next 2-3 decades, by 2050, we are expected to have around 20% of our population coming under the 60+ category or senior citizens. That will be approximately around 320 million elderly population in our country. So this survey and the study designed for next 25 years, planning to go back to the same households and individuals to understand their social, economic health, including the mental health conditions of the elderly, their living arrangements, their health-seeking behaviors, everything on a continuous basis. So our plan is to go back to the households every 2.5 years to understand the changes happening to their physical, health and economic conditions. Now, International Institute for Population Sciences is carrying out this important study. The first wave of this survey was carried out all over India, including all the states and union territories, except in Sikkim, which covered around 72,000 individuals from 43,000 households spread across the country. We are conducting this survey in collaboration with our international partners, Harvard School of Public Health and University of Southern California. And it is also financially supported by Ministry of Health and Family Welfare, Government of India, National Institute of Health, USA, and United Nations Population Fund, UNFPA, India. So basically, that is about the survey. Now, this is the first step. So we are joining an elite club of health and retirement studies around the world. Around 40 countries currently have the similar type of surveys, starting from the health and retirement study in the United States to most of the European countries have. In Asia, we have the Korean, Chinese, Indonesian, and Japanese aging studies. So India is joining the elite club of health and retirement studies, and our survey protocols, instruments, all are designed for international comparison. So we are able to produce a scientifically based and internationally comparable database to understand the conditions of elderly in our country.
Right.
Yesterday, the Honorable Health Minister, Dr. Harshvardhanji, released this first wave report of LASI study, and he said that this survey and the findings is going to help the government and particularly the health ministry to streamline various ongoing programs for the elderly, their health care, and also. We also have a large database on the various social security measures for the elderly, the survey also gathering that information.
Well, Dr. Sekher, just stay on. We will come to the finer points of survey as we go along in the show. Let me have other panelists to join in as well. Ms. Urvashi Prasad, many thanks for joining us from Niti Aayog. Ma'am, to understand and to put things in perspective, as Dr. Sekher just mentioned, that this is one of the largest surveys of the world, or the largest survey of the world, given the population size. Now, given the programs and policies that we have so far for the elderly people, how this survey would help to have further, or to say better policies for the aging population of the country?
Yes, I think, for any policy making, having this kind of data is really very important, because that is what, helps us understand where we need to focus and what we need to prioritize. And of course, this is really the other side of India's demographic dividend. We often talk about our demographic dividend, but we often miss out that actually we have a sizable and growing population of senior citizens as well. And that number is only going to become larger, as the survey has also shown in the years to come. So it clearly shows that, while on the one hand, we still have a lot of our policies focused on younger people, we also now need to really focus on policies in all areas, be it health, be it nutrition, be it on the economic side, social security, for senior citizens, because of course, senior citizens are not one homogeneous group. There are lots of differences. And I think the survey, has also highlighted some of those in terms of the socio-economic differences, the health challenges in terms of chronic diseases, etc. So we have to really make policies which can tailor to the specific needs of senior citizens who come in different categories. And for that, having data and really knowing, what is our challenge in which socioeconomic segment and what do we need to focus on when it comes to healthcare or any other area is really a very, very important tool. So I think in that context, this survey is extremely important and very timely, because, this is just the time when we need to start thinking of, how do we implement policies. The policies have been around for senior citizens. We have many programs in existence, but I think we need to implement them with a lot more sort of earnest, in a much more earnest manner, and with a lot more focus. And I think that is what a survey like this, which really highlights the issues at the highest levels, and the health minister himself taking note of the findings and releasing this first set of findings is I think it's very important and it's very timely as well.
Right. Urvashi, just stay on. Dr. Sekher, let me go back to you as you were discussing about the finer details of the survey. Now, we know that this survey or the study has fairly large dimensions or multi-layered dimensions to it. Now, to begin with, or let's focus on the important ones. Now, given the health parameters, where does our elderly population stand, if I may put it in a very simplified manner?
Okay. We have a large set of information and data gathered, covering all dimensions of health, both physical, reported, and the measured health conditions. I want to emphasize here, we are not only asking the questions and finding out the response from the elderly, but we are also conducting large number of biomarkers to find out the actual health conditions. So we are in a position to compare the reported conditions and actually measured and the differences. So we have a large number of, we are taking the anthropometric measures. We are collecting the dried blood spot samples and testing for diabetes and hemoglobin levels. We are also doing vision test, the memory test, grip strength, and lung function test using spirometry. So we have a large biomarkers included in this survey, which will give us the actual situation of the elderly's health conditions. Now, in order to give you some idea about the conditions, we found, based on the LASI survey, nearly 34% of the India's elderly have at least one chronic health conditions, or they are suffering with one of the chronic health problems.
Right.
And if you see the cardiovascular diseases coming around 34% among them, hypertension 32%, bone and joint disease 19%, diabetes 14%, lung diseases 8%, heart diseases 5%, anemia among 5% of elderly, stroke nearly 3%, and cancer 0.7% among the elderly. So this is one of important broad findings emerging out of the LASI study. But what is more interesting is that nearly 3/4 of them are currently getting treated for various chronic health conditions. That means a large number of them are yet to get the proper treatment. For example, 83% of the persons having the diabetes are regularly undergoing treatment. And 77% having the hypertension are getting treatment. And similar way, many other chronic health conditions, they are getting the treatment. We also observed that in the context of the present pandemic and the COVID-19, nearly 23% of elderly in India have multi-morbid conditions. That is a very important figure. 23% of India's senior citizens having the multi-morbid health conditions. So these are some of the important issues and findings coming out of the LASI study, which was sponsored under the National Program for Health Care of Elderly in the India's Health Ministry. And that is one thing. Then coming about the mental health, nearly 8% of the elderly have, we observe certain level of depression happening to them. And if you go the 75 plus elderly, that percentage increases to 9 to around 10%. And we found it is more among the women, the rural residents, widowed and elderly living alone. And we also found nearly 11% of the elderly are having physical impairment, either locomotor problems, visual, mental, or hearing. And the locomotor disabilities impairment is highest among 6% of elderly, and visual is around 4% of the elderly. Another important dimension of the survey, which in most of the surveys all over the world do, is that we have something called activities of daily living. Whether the person is able to carry out the basic daily routine activities like taking a bath, using the toilet, having the food, and all other things. We found that 24% of the India's elderly have at least one limitation in doing these activities of daily living, and 14% of the elderly have two or more limitations. And we also have the data for
Dr. Sekher, we'll just come back to this.
IAD.
We'll come back to the civil infrastructure data. But let me, before I go off to Urvashi, because she represents Niti Aayog, so before I ask her this question, very briefly, sir, you just mentioned about the health issues among the senior citizens now, or our elderly population. How many of them have, or as per your study, easy access to, comfortable access to healthcare facility? Very briefly, just a number to it. Yeah.
Nearly 3/4 of them are getting the treatment.
Okay.
For those who are reported the chronic health conditions.
Right, sir.
That automatically means they have the access to the health facilities and they are getting the treatment. Right.
Well, let me go off to Urvashi here. Urvashi, the numbers here speak for itself, and I'm not saying there is any lacuna in terms of the policy. Now, as we go forward and we discuss as to how we can take care of elderly in a better state, so where are these areas which perhaps requires more addressal in terms of access to healthcare vis-a-vis our elderly population? Which are the areas where policymakers need to emphasize on? Urvashi.
So I think the most important, and this is true for all life stages and very much for the elderly as well, investing in preventive health and primary healthcare, which also means early detection, is very important, because our numbers are too large. We cannot afford to put everybody into hospitals and only treat people in hospitals, and that's true for senior citizens also. Of course, you need the specialty treatment. You need geriatric specialities in the secondary and tertiary levels of care, but that is not how the health system can or should be oriented, especially when we are dealing with such large numbers. So when we talk of Ayushman Bharat, the government already has a provision for health and wellness centers, and it's very important that we include geriatric care in these health and wellness centers as well, so that people can be screened for chronic diseases. They can be provided basic preventive services closer to their homes. And that is, I think, a very important point, because we cannot have every service being provided necessarily in an institutional setting. So the health and wellness centers have a very important role to play going forward, as does the whole segment of home healthcare, especially in the urban areas where you have more nuclear families now. You have, of course, this trend of chronic diseases on the rise. So you need constant care. You need regular care for these diseases. So the home healthcare segment also in India needs to be developed. It's so far been, it's at a fairly nascent stage, but there is huge potential there, because you can train people, you can skill them, to be attendants, to be caregivers. It also creates a lot of employment opportunities, and they can provide at least basic care services to elderly. In urban areas especially, of course, people who are in poorer settings, we might need to apply differentiated strategies there. But certainly in the urban centers, there is huge potential for home healthcare. And then, of course, we need the health and wellness centers. And then the second component of Ayushman Bharat, which is the Pradhan Mantri Jan Arogya Yojana, which is the insurance scheme. Of course, we are continuously expanding this to include more and more procedures. So that, of course, will also benefit the elderly in terms of, different kinds of interventions getting covered. But we need to expand access to the actual healthcare facilities. We still have a lot of our facilities concentrated in the larger metros or larger urban centers, and that is where the government is trying to work with the private sector as well to push these facilities into tier 2, tier 3, cities, towns, and ultimately into the rural areas as well, because it's very important to have access closer to the home, rather than expecting people to travel long distances to, access care, especially for chronic diseases, which, as I said, you need constant treatment. It's not a one-off. You need constant care. So I think these are some of the areas where, per se, we have them reflected in our policies, but we need to bring in that extra focus and orientation towards geriatric care. And now that we have this kind of data available, we also need to segment. We also need to see which group requires what type of specialized care. So like, was mentioned that there's an intersection of senior citizens issues with disability. So how do we tackle those? That requires a certain, specific set of policy measures. Then you have women, who might be widows and also from poorer socioeconomic backgrounds. Absolutely. So how do we deal with those senior citizens? So I think we'll need more tailored, more customized strategies. I think the basic policies are in place, but we need to implement them with a much more focus on the geriatric side. And the other is we need to segment and have more customized strategies.
Right. That's very important, and I'm sure like the survey with such a size and scale would we'll definitely address those finer points. Dr. Sekher, as we go about to close the show, let me just ask you one last question here. Sir, in terms of the survey, if we broad base it, besides the health, which is of course the ongoing challenge, which are the other areas that obviously raises some issues that is wanting from the policymaker sides to invest on the elderly population?
Yeah, I think there are many issues and many challenges, and the findings from the survey are giving us more clarity and more specific issues on this. One specific issue may be the old age security for the elderly in our country.
You mean employment?
Now we have a large old age pension scheme.
Okay.
But
right.
Nearly 1/4 of the elderly belonging to the BPL households are receiving the old age pension, and nearly 1/4 of the widowed elderly also receiving the widow pension. So there is a lot of scope to enhance the coverage of the old age pension. That is one area. With regard to the health insurance as such,
that's important.
According to our survey, nearly 1/5 of the older adults 45 and above have covered by some form of health insurance.
Okay.
That is the data we have. And coming to the health expenditure and other things, we have a lot of information. Another thing, the family and living arrangements are also changing gradually.
Yeah.
According to the survey, nearly 6% of elderly in India are living alone. And if you take the woman, it is around 9%.
Okay.
So gradually we are seeing more and more elderly citizens are living alone or forced to live alone. That is one important challenge. We also noticed the problems of ill treatment and abuse happening to elderly both within the household and outside the household.
Right.
It is an issue all over the world. Elderly individuals were treated without much respect and sometimes ill-treated by their own family members.
Yes.
And these incidences are often reported, and Government of India has taken various measures to protect them, including the Maintenance and Welfare of Parents and Senior Citizens Act, which was passed by the Parliament in 2007.
Yes.
But we found that the awareness about this act is nearly 20% among the elderly in our country. So we need to publicize and create awareness about the various provisions and acts to protect the welfare of the elderly in our country.
Right. Well, many thanks. Just to you, last word, Dr. Rishi Prasad, as Dr. T.V. Sekher just underlined in his closing remarks that there is, of course, legislation, there are constitutional provisions for the safeguarding of the elderly people, but awareness seems to be much, much lower. What perhaps can be done for that? I mean, is it only elderly who needs awareness, or the population at large requires to be given or at least imparted these duties towards elderly?
Yes, absolutely. I think, definitely we do need to create more awareness about these provisions. As I said, earlier as well, that we have a lot of the provisions in place, but where we struggle is the implementation, because of course we are a very large and diverse country, and a lot of the elderly population also is spread across the different socioeconomic segments, rural urban divides, etc. So we need to, of course, make concerted efforts, the central government in partnership with state governments, to create awareness about these provisions, but B, also ensure their effective implementation, which needs a lot of training of the personnel who are involved in implementing. And training, I mean, not just, on the legal side, but also sensitization, on how do you deal. And we find this, when it comes to issues with women as well, that often the workforce, is not, which is working in these areas, is not fully sensitized to a lot of these issues. So that's an important part of the training as well. And of course, we need to make people in general more aware of their responsibilities, of their duties towards the elders in their family. And I think this has to be an important social movement as well. The government, of course, has a role to play, but I think the broader society, citizens, civil society, we have also a very important role to play in making sure that the word gets out that, we need to be very responsible. We need to look after senior citizens, and we certainly cannot, have instances of violence or abandonment, being tolerated. So I think that needs to go out as well. But I think overall, as I said, that we need a skilled cadre of workers. It's the caregivers, it's the psychosocial support services, it's the patient attendants. Then I think it's a huge opportunity for the economy as well. As I touched upon earlier, this is a segment which we can really tap, from an economic point of view. We can bring in people from rural areas as well, even those who have basic qualifications and communication skills, and we can train them, in how to look after the elderly. As the surveys also show, a lot of people are living by themselves, so they do need this kind of assistance. They do need this kind of support. So I think it's both a challenge and an opportunity. And of course, the government has a very, very big role to play. There's no doubt. But I think especially when it comes to issues of, sensitivity and empathy, we need to, as a society, also look at these and, really make it a big movement so that we don't come across these unfortunate instances where you have senior citizens who are ill-treated or who are abandoned.
Well, that's it. That's right, Urvashi, and many thanks for joining us. Many thanks, Dr. T.V. Sekher, for joining us and throwing light upon this extremely gigantic set of work, which definitely will guide our policymakers in years to come as to what needs to be done to better the life of our elderly population. Well, many thanks for joining us and watching this edition of Discussion Today. Keep watching Rajya Sabha TV for more. Thank you. Goodbye.